you the Camp Alive tonight. The earthquake down in Christchurch stopped my speech a week ago. So things are a little bit mischievous. As you all know who I am, I'm Alan Smith. I'm the man that the documentary was done on 60 Minutes on the 18th and done partially about here last Wednesday. The title was of the documentary was about Back from the Dead. Well, I'm back. It also was about a miracle cure and living proof. Well, I am living proof. There's no doubt about that. The miracle, I claim, the miracle is about my family and the health. The miracle was to overcome the doctors, to be able to get their arrogance out of their head. And to get them to just administer simple vitamin C to me, intravenously. And that was a major turn in the industry. At this stage, I'd like to thank those doctors, and especially those nurses that looked after me. They gave me unbelievable care. I went back to the hospital twice on 2 occasions to thank them, and they were very happy to see me, believe me. It was amazing that the recovery that I had, and considering that turning me off and putting me back on, that I actually survived. But as proof has it, the vitamin C pulled me through it, and I was very, very lucky to survive. I understand that all of you are wondering where and how the family got the information and where it come from. Well, it was very simple, really. I had a lovely brother-in-law that knew all about vitamin C. He'd been doing a lot of research. He's actually a panel beater by trade, a builder. Just an ordinary man that goes to work 5 or 6 days of work, and he goes fishing with me occasionally. And I. Now this man, I used to take the slack out of this guy. I knew him since he was 6 years of age. I've looked upon him as my brother. He emailed our guest speaker that we have here tonight in desperation because he was pleading with the doctors to give me vitamin C. And the doctors just said, no, there's no proof, there's no evidence. So...
You are the evidence.
Exactly. He emailed our guest speaker tonight, and he set the wheels in motion, as to speak. This man is not only my brother-in-law's age, he's now mine. This man is a lawyer. He has a degree in biology. He's a cardiologist. He's an author of a book. It's a book called, I'm not sure what the name of the book is. Curing the Incredible.
Curing the...
Sorry. So, ladies and gentlemen, I'd like you all to stand and welcome Mr. Thomas Levy to the stage.
I'm very pleased to be here. This is my second time in New Zealand, and I'm especially pleased that I can be here on an occasion like this. But let me say at the outset that what happened to Mr. Smith, to most physicians, most laypersons that don't know about vitamin C truly was a miracle. But I got to tell you, when you've worked with vitamin C for much of your life, especially as a medical professional, it's a wonderful thing, but it's not a miracle. It's just hard science, and it's the result that I would expect to happen the majority of the time with a patient even as far advanced as Mr. Alan Smith was with his swine flu. Next. I don't know how many of you know Mark Twain in the United States, but be careful in reading health books. You may die of a misprint. Next. Now, when I get back to the States next week, I'm going to put this entire presentation on my website, and many of the references that you can see in here, you can click on in your computer and you can go directly to some of the full original articles as well as the abstracts, so you'll have a wealth of information at your fingertips for both yourself and for anybody else that you may know that would be interested. So you'll have a lot of documentation you can work with for your health provider or your family or your friends. Now, also throughout this presentation, when I mention an article, I put the author's name, a number, which is the volume number, and another number, which is the first page number. And if you go to this website, which is called PubMed, and enter in that box the author name, the volume number, the page number, you will go immediately to that abstract or article, so you can see the original source of information. Next. Now, this often occupies an entire lecture, but that's not the thrust of this one, and that is the facts on how vitamin C works. Quite simply, quite elegantly, all infections do their damage with what's called oxidative stress or electron theft, electron robbery. And the laboratory tests show this. All toxins, in the same fashion, cause all their damage by electron theft. Vitamin C, as an antioxidant, its ultimate task is to contribute electrons. And it's really that simple. So if you have something, an electron source, that can go in and immediately replace the electrons that were taken away by your toxins, by your infections, you repair the tissue damage and you prevent more. It's that simple. And this is why, when I first encountered all this information, I already knew that vitamin C, if you gave a large intravenous drip, could neutralize virtually any toxin imaginable. No matter what the toxin was, snake bite, barbiturates, mercury, anything you can think of. And I said, how can one molecule, just from a biochemical point of view, I said, how can one molecule neutralize 100 different diverse molecules? Well, there had to be a final common denominator, and this denominator is electron flow. Whether electrons are taken away or whether electrons are donated is the final common denominator as to whether or not you make somebody better or worse. Next. Now, the facts. Antimicrobial, antiviral. And this again, this connection here will put you with the complete original article. Dr. Frederick Klenner, in 1949, cured 60 out of 60 cases of polio. And it was in the middle of a polio epidemic, so there was little doubt about the diagnosis. But even if a fraction of them weren't polio, it's still a cured polio and whatever viral syndrome presented in these infants 100% of the time. Now, even then, if a cynic wants to disregard that and say, well, maybe it's a cold, maybe it was some nonspecific virus and the baby just got better. Dr. Klenner reported another case in 1951 where the child already had polio for 2 weeks and had flaccid, that's like dead muscle paralysis in the lower extremities. At that stage of polio, the vitamin C infusions brought a complete cure. It took a little longer than the other polio patients that didn't have any paralysis. They were resolved in 3 to 5 days. This child, because of the paralysis, required a full 2 weeks. Next. Now, one of the more fascinating articles you can run across, because it tells very vividly, in very human terms, the problems that Dr. Klenner encountered in trying to inform his fellow doctors of what he was achieving. And the article that Dr. Landwehr wrote is called The Origin of the 42-Year-Old Stonewall of Vitamin C. And again, you can access this entire article online and see the details of how Dr. Klenner went to the conference of the American Medical Association in Chicago, and he was based in North Carolina, presented his findings that I told you about polio to the entire Congress, and it didn't rouse a question. It didn't rouse a blink. It was a symposium on polio, and the next doctors got on and started talking about the artificial support of the respiration that gets paralyzed in polio patients, and Klenner was forgotten as quickly as he stopped talking. So I suggested that the title should now read The Origin of the 61-Year-Old Stonewall of Vitamin C. Next. Now, we've got a lot to cover that are important points tonight, and I could speak for hours on some of this, so I'm going to go quickly over some things that are very important, but that's why you have these references. You can go straight to them. Go to PubMed, type in Dalton 55, 1151, and you'll see the article or the abstract. Well, in point of fact, vitamin C has and routinely, completely and totally cures acute hepatitis. I say acute, not chronic. Chronic hepatitis is a different bag of worms. The microbe, the virus, is much more difficult to reach with a therapeutic agent, but in acute hepatitis, across the board, vitamin C, given intravenously in adequate doses, will give you a complete clinical resolution of the patient, including normalization of the astronomical liver enzyme test that you see in acute hepatitis in 7 to 10 days. Now, we saw with Mr. Smith, he was in an induced coma, and maybe toward the end of the time period on the ECMO machine, it was probably a real coma. But what I said earlier is his response, while virtually miraculous to someone who didn't know about vitamin C, it's reasonably expected. Dr. Klenner routinely, multiple occasions, took cases of viral encephalitis where the patients had already progressed to a complete coma, and not only cured them, but brought them back to consciousness, usually between 12 and 24 hours after initiating the high-dose vitamin C. Vitamin C is an absolute viricide. That means, in the test tube, if you have virus and you have vitamin C, the virus is dead. Or in the case of virus, it no longer replicates. Vitamin C is an absolute viricide. Next. Now, a very good article, if you start to get fascinated about Dr. Klenner and want to see more of the things that he did and more of the things that he published, his own personal review article of what he had done through his entire medical career is at this site, and again, you have the entire article. But it's his own review article covering many of the different conditions he treated and cured successfully with vitamin C, and believe me, it was a huge number. A very huge number. Next, please. Now, in Dr. Klenner's own words, and I agree with this completely for what it's worth, some patients would stand by, some physicians would stand by and see their patients die rather than use ascorbic acid because in their finite minds it exists only as a vitamin. Vitamin C should, that's my emphasis, be given to the patient while the doctors ponder the diagnosis. And in fact, this is no joke, in Dr. Klenner's office in Reidsville, North Carolina, his nurses were instructed, when any patient came in, to hook them up to the vitamin C first before they even called him. Next, please. Now, here's an example, and it gets repeated over and over again. Well, how can this be ignored, or how can this really be in the literature and not be acted on? I can't tell you for sure, but I can cite you the examples and you can judge for yourself. Acute rheumatic fever. In the New England Journal of Medicine, of all journals, Dr. Massell and his colleagues reported on 7 different young people who presented with acute rheumatic fever. He gave them a variety of different doses of vitamin C. Each one, by Dr. Massell's own description, had complete resolution of their symptoms in a few days or less. In this case, fever, chest pain, shortness of breath, swelling of extremities. A complete clinical resolution. It was interesting that he described the complete resolution, but didn't describe what he achieved as being a cure. Well, I mean, if the temperature comes to normal, the breathing comes to normal, the heart rate comes to normal, all the lab tests normalize, and the patient feels in perfectly good health, I think you can say they're cured. But, and this is the mindset of virtually all the literature about vitamin C, and many other positive things that are used by many physicians, but not the mainstream. And that is, the authors only wanted to conclude that vitamin C had anti-rheumatic activity. And this is what you see over and over and over again in the thousands upon thousands of articles on vitamin C in the literature, but more research was needed. It did this, but now we need more research to better quantify it. So, and in the particular case of acute rheumatic fever, again in 1950, I made a concerted effort to look everywhere I could find, and in my search, I could find no significant additional research of the clinical application against acute rheumatic fever ever again with vitamin C. So you had a fabulous result of 7 children virtually clinically cured of their rheumatic fever with oral intravenous vitamin C, and that's where it ended. You explain it. I can't. Next. Antitoxin. Vitamin C is the ultimate antitoxin. For goodness sakes, Australia, New Zealand. Well, you have snakes in New Zealand, or is that just Australia?
Just Australia.
Oh, okay. Well, remember the snakes when you visit Australia. Vitamin C and a couple other antioxidants, in this case alpha-lipoic acid and acetylcysteine. 3 separate reports in the literature have cured toxic mushroom poisoning. Now, in case you don't know, the mushroom Amanita phalloides is one of the worst poisonings anybody can endure. And once the fatal amount of mushrooms have been ingested, if you manage to do enough to get the mushrooms out, you induce an acute liver failure, and the patient either dies of acute liver failure or they need a liver transplantation. It is an absolute, horrible, brutal poisoning. But here we have 3 innocent antioxidants in the literature. I mean, check out these for yourself. That's why I have this here. Check it out yourself. It's in the literature. It cured toxic mushroom poisoning, but there's not a poison center on the planet that uses them. Tell me why. I don't know. Every time I make suggestions, people say, well, that can't be. I said, okay, well, you fill in the blanks. Next, please. Now, in looking at the research that Dr. Klenner did, and Dr. Klenner is the foremost researcher on this, few early researchers followed Dr. Klenner's lead in using high multi-gram doses 25, 30, 40, 50 grams or more of intravenous vitamin C for any of his wide variety of infections or toxin exposures. However, most of the decisive studies came from Dr. Kletter's 20-plus papers that he published. Now, you'll see, if you spend any time going through this literature, that a very large portion of the vitamin C literature, whether it's on an infection, on a toxin, whatever the clinical condition was performed typically with daily doses of less than 1,000 milligram or 1 gram. So compare that 1 gram to 50 grams. Much, much, much less. But even at these relative minuscule doses, the positive results continue to pour in. Next, please. Now, just for myself, I've given, ordered, or monitored several thousand vitamin C infusions at this point in time and gone much higher than 50 grams. Now, as a cardiologist, I certainly didn't have the occasion to see polio, measles, mumps, diphtheria, many of the infectious diseases Dr. Kletter encountered. But I did have a little overlap. I did encounter a few of the diseases that Dr. Kletter encountered, and I encountered one disease that wasn't around or wasn't recognized when Dr. Kletter was doing his work. In 2 cases of chronic infectious mononucleosis, and these were both college kids, and they were so devastated and depleted by their mononucleosis that they had to drop out of college because they were so fatigued, and both of them had been sick for months. Within 3 days of vitamin C infusions, they were both 100% well. In 2 of 2 cases of West Nile disease, I don't know how much of that you've heard over here, but it's big in the Rocky Mountains. And again, I had 2 patients. One of them was so sick he looked like he had acute hepatitis as well, but it was the West Nile virus in the liver. He and the other patient, again, were completely well in 3 days. Now, I've spent a lot of time in South America. My wife is from South America. And one of her relatives, a cousin, a young teenager, I believe 15-year-old girl, developed dengue fever. Now, read about dengue fever. It's a pretty nasty disease. And when the dengue fever has progressed to the point that it's hemorrhagic, and in this particular case, she qualified because she started getting blood in her urine. I didn't have the IV with me. Using only oral liposome encapsulated vitamin C, she was completely cured in 3 days. With a total of about 10 grams of vitamin C by this application. Next.
Can you tell us how much that is, those tablets? Can you tell us how much those tablets are?
It was 10 packets, which is 1 gram in each packet. 10 grams total of vitamin C, but in a liposome encapsulated form.
And how much money?
How much money does that cost? It's about $10 worth of vitamin C. Now, I just want to briefly show you a few of the other things that vitamin C does, a few of the things that it's been documented to do, documented to prevent, and its effects on health in general. Again, all with references to the literature that can be readily checked. Now, vitamin C exerts anti-cancer activity both in the test tube and in the body. This article. Now, and these are also full articles, so you can see the full article. And 3 more cases showed vitamin C to be an effective cancer therapy. Next slide. 7 advanced cancer case reports successfully treated with IV vitamin C. What does successfully treated mean? It means you take someone that's being predicted to die, and they're still alive years later. Maybe still with their cancer, but they're alive and only minimally symptomatic. Okay? This again will give you the full article. These are just a sample. You can find articles like this all over the place. Next one, please. Now, when you just look at statistical studies where they look at series of patients and measure blood levels of vitamin C. What happens? When you examine specific cancers, the higher the plasma level of vitamin C, the lower the incidence of gastric cancer. Next. Now, this was an incredible, in my opinion, statistical study that again looked at these blood levels of vitamin C and looked at the incidence of different diseases and looked at what they call all-cause mortality. In other words, your chance of dying of whatever. In this case, it was very clear that the highest plasma levels of vitamin C were associated with the least mortality from heart disease, including cancer. And to be more specific, and you can see it was a large study, nearly 20,000 men and women. In 20,000 men and women, they found that those that had the top 20% vitamin C levels had about half the risk of dying as the bottom 20%. Clear, cut, clean. Next. As well, coronary artery disease. Independent of classical risk factors. They always look at these risk factors and they seem to can't be able to sort one from the other. Well, they were able to statistically eliminate the effect of other risk factors and found that high plasma vitamin C levels were clearly associated with a lower risk of coronary artery disease. And when you examine what's going on in coronary artery disease, this is no surprise at all, because atherosclerosis is nothing more than focal arterial scurvy. When the blood level in your endothelium of your coronary artery starts to approach zero, your body mobilizes white blood cells, causing inflammation, bringing in cholesterol, and starting your atherosclerotic process. In my book, Stop America's #1 Killer, we go through 25 of the classical risk factors, and we can show through examining the medical literature that all of those factors ultimately come down to the final common denominator of a focal vitamin C deficiency in the coronary arterial wall. It's really that simple. The only thing that makes it complicated is dealing with this problem is not as simple as just taking vitamin C, because you have to address the reasons why the vitamin C is depleted in the first place. And this comes around to something else that I did for quite a few years now with Dr. Hal Huggins and others, and that is dental toxicity. Dental toxicity, particularly root canal treated teeth, consume antioxidants at a phenomenal rate, deposit bacteria, virus, fungi, other microbes directly into the blood that go from your jawbone, circulate through the pulmonary arteries, and come directly into the left atrium of the heart. And the first squeeze of the left ventricle, guess what's the first arterial system waiting for those microbes and toxins? The coronary arteries, which take up 25% of that cardiac output before it gets anywhere else in the body. So that's a real short nutshell of what coronary artery disease is all about. Next. Also, continuing the same broken record, higher plasma levels of vitamin C are again inversely associated with a lower incidence of diabetes. Part of this is simply because glucose and vitamin C compete for and use the same receptors to get inside the cell. So when you start having chronically lowered levels of vitamin C in your blood, more glucose is unable to get in. Next, please. Okay, now, this is the next, I don't know, 5 or 6 slides are very important because, I'll say it, medicine, modern medicine, through the popular press, through the scientific literature, they just lie. truth. I'll give you the truth. Now, again, you can get the full article. Vitamin C, and I don't know how many other substances you can say this about, has no known definable toxic dose. How many antibiotics, anti-inflammatory agents, calcium inhibitors, any type of prescription drug you can think of, can you say there's no known toxic dose? You just can take as much as you want of it, and you're not going to hurt yourself. Well, this is pretty much the case with vitamin C. Now, in this particular group, they gave 427 pounds of vitamin C to 275 patients over a 16-year period and had no definable side effects. That's pretty toxic. Next, please. Now, there's a little-known university in the States, Harvard, yes. Cambridge, Massachusetts, okay. Now, in this ridiculously non-academic institution, they looked at some 86,000 women with no history of kidney stones and found, in their words, that vitamin C was not associated with the risk of developing kidney stones. And they advised, and this is a direct quote, routine restriction of vitamin C to prevent stone formation appears unwarranted. Okay. Next, please. Now, another study from that same institution, the Harvard Prospective Health Professional Follow-Up Study. Follow this. The intake of high doses of vitamin C does not increase the risk of calcium oxalate kidney stones. In fact, the members of the group that they examined with the highest vitamin C intake had a lower risk of kidney stones than those with the lowest intake. Pretty doggone toxic. Next, please. We talk about somebody coming and just getting an IV vitamin C. Well, here they gave terminal cancer patients. Now, that tends to be a pretty sick group. Everything's sort of trashy. The organ systems are failing. They have a dozen different things going on with them. They're not exactly what you call a nice, normal, healthy person that you're giving vitamin C to, but they gave vitamin C infusions 50 grams daily over an 8-week period. No definable negative side effects. Next. Okay. This one looked at serum vitamin C levels, reached the same conclusion. No evidence to indicate that vitamin C levels increase the prevalence of kidney stones. And they as well were able to identify that the highest blood levels of vitamin C were equated to the lowest incidence of kidney stones. Next. Okay, now, let's get a little bit more into the science. This gets a little involved, but I don't think it's too much to comprehend, and it will allow you to understand some of the nonstop propaganda that continues to hit our papers and our magazines, you name it, about the latest threat of vitamin C. Now, part of this has to do with understanding what's the difference between a risk factor and a causing or propagating factor. Okay? Now, in a patient who already has the predisposition to be forming calcium oxalate stones, of course, the more oxalate you give them, the more stones are going to form. But that does not mean high oxalate causes kidney diseases or kidney stones. It's the fuel for the fire. It's not the cause. Okay? Now, what's our best evidence of this? Well, number one, and this is outlined in the book, I actually outlined 60 factors. Over 5,500 factors, in addition to vitamin C, can raise urinary oxalate levels. And in all of the patients that are cited in the literature, the 4 or 5 patients that I know of that got vitamin C, and got kidney stones, they all, number one, had pre-existing kidney disease, and number two, they had many other factors that increased their urinary oxalate. Now, here we have an article. I encourage you to look at it. In pregnancy, believe it or not, for whatever reason, in the 3rd trimester of pregnancy, routinely, as part of the physiological process of pregnancy, the urine becomes supersaturated with calcium oxalate to the same degree as known kidney stone forming patients. Yet with this supersaturation of the calcium oxalate, there's no increased risk of stones in pregnancy. I mean, how many of your family, friends that the young women have delivered babies, have you heard that they're hospitalized with kidney stones? So, the concentration of oxalate, of calcium oxalate, is not the determining factor of whether or not you develop a kidney stone. Now, if you start to develop one for another reason, it will propagate it. So, remember, elevated urine oxalate is a risk factor for stone disease in patients with pre-existing kidney disease only. Next. Now, and this too, this article came out in 2010. Again, the full article's available. Even though it's still not used in most hospitals currently, high-dose intravenous vitamin C is now used widely around the world in doctors' clinics and offices. Again, no data has come in indicating kidney problems in patients that start with normal kidney function. Next. Okay, this one I like. And this is not fiction. This might catch a bunch of you off guard. I don't know. We'll see. A person with normal kidney function can successfully kill himself by drinking too much water. Psychiatric patients do it all the time. They develop water drinking obsessions. And they just drink water, drink water, drink water, drink water until their serum sodium dilutes down to the point where they start having seizures and then often die.
How many liters is that?
I can't tell you. I don't know.
5, 10, 15?
I don't know. I do cite the article here. They might give you the details on that there. Now, well, gosh, if you can drink enough water to kill yourself, doesn't that mean water's toxic? That's a pretty negative side effect, death. So, you can drink enough water to kill yourself, but there is no established dose at or which or beyond which you can reliably kill yourself with vitamin C. So, I pose the question, is water more toxic than vitamin C? Next, please. Okay. Now, like any other therapy, it's nice to have a physician, nurse, have some expertise in whatever therapy they're giving you. I think that's a reasonable desire on the part of the patient. So, I'm not terribly much in favor of these doctors that know nothing at all about vitamin C to be administering infusions because they really don't know the most simple of basic principles on what to do in different clinical situations. You can get hypoglycemia, a number of other things that I'm not going to cover tonight. They're all easily addressed if you know what you're doing. I mean, in the cath lab, when we catheterize a patient, you may not know this, but every now and then, that catheter tickles the heart, and you go into VTAC. Or, in one case, you go into ventricular fibrillation. Well, if your doctor gets excited and poops in his pants, you die. But if he knows what he's doing, he takes out the paddles, shocks you, and continues the procedure, and no harm, no foul. So competence is important. Now, I had one patient where I was pushing the envelope, and after his 300th gram of vitamin C that day, he said, I'm getting a little flank discomfort over the kidney area. Well, I felt like pooping at the time, but I stopped and thought and said, well, we're probably at the limit of osmotic stress that his kidney wants to deal with, and there's enough hyperconcentration inside the urine that is probably partially dehydrating the renal parenchymal cells. So I said, we'll stop the IV, start giving a lot of normal saline, and then give him an IV diuretic that immediately brings in a large, fast urine flow, and everything was fine. On the other hand, if I hadn't done anything, this might have been a patient that we could have pushed to kidney stones. Who knows? But again, measure and treat with intelligence and competence. And this was the only one that had any reaction like this out of thousands. So I don't know any prescription drug that has that type of profile. Matter of fact, I challenge you to find any prescription drug, anti-inflammatory, antibiotic, statin, you name it, that hasn't killed thousands of people worldwide. Find one. Okay, next. So, virtually any treatment that's potent enough to cure a condition can be made toxic by incompetent administration and unawareness of body chemistry and physiology. And you don't want anybody giving you your IV vitamin C anymore than I think you want a car mechanic doing your heart surgery. So, I will say it's not rocket science. If you have an otherwise qualified doctor or nurse, only a little bit of additional education is indicated for them to administrate vitamin C with optimal safety and efficiency. Next. Now, another one of my quotes. Let no one, boy, is this true? Let no one who has the slightest desire to live in peace and quietness be tempted under any circumstances to enter upon the chivalrous task of trying to correct a popular error. I suppose I'm making a lot of friends here, but I'm making a lot of the other variety too. But you got to do what you got to do. I got to say this, I'm not placing any halos on my head, but staying in traditional cardiology 15 years ago and doing my angiograms and driving my Porsche and everything else would be a lot less stressful and a lot more lucrative than what I'm doing now. Next. And in the great Linus Pauling's words, I think is especially appropriate in what's going on now. Do not let either the medical authorities or the politicians mislead you. Find out what the facts are and make your own decisions about how to lead a happy life and how to work for a better world. Next. Now we're going to talk about the law. It's kind of funny. I thought the other day and realized that I've had my law degree for about 12 years now, and I haven't really done anything with it. Except, I think I write a little better. Boy, do you write a lot in law school. I mean, you figure out really quick how to say something simply and elegantly versus rambling on and on. Well, the time has come. Now, from the New Zealand Bill of Rights Act 1990, you had the right not to be deprived of life. Okay? Plain and simple. Now, bear in mind, the intentional withholding of a life-saving therapy is a treatment decision that directly violates this right. Next. Now, in the New Zealand Medical Council's Good Medical Practice Guide for Doctors, asserts that doctors have a duty to actively research available information on non-mainstream, I hate these words, complementary and alternative treatments. It makes it sound immediately when you say, I've got a complementary or alternative treatment, that it's obviously inferior to what the mainstream is doing. Well, I've got news for you. The mainstream medicine has a lot of good stuff and a lot of crap. The complementary alternative realm has a lot of good stuff and a lot of crap. What you need to do is drop all of the terms and pursue what I call science-based medicine. I march to the drummer of science. There are established methodologies in clinical studies, in laboratory studies, and research studies, how to acquire accurate science-based logical information. And that's what you should insist on, whether you're talking to your mainstream doctor, whether you're talking to your holistic doctor, or whatever the heck you want to call him or her. Demand science. Now, as well, this guide indicates that the doctor must make a referral to another doctor when the patient or legal representative of the patient so requests. He doesn't have an option, but you need to know that. Next. Now, this is a very important slide should you get in a situation you don't want to get into. When the doctor refuses to be open to education or consultation, the patient has the right to information about the doctor's preferred treatment that he wants to give in writing. You're also entitled to information as to why the doctor refuses to give the treatment in question, vitamin C, in writing. You have the right to be treated by a doctor that is familiar and supportive of that treatment, assuming it's an established treatment, which I'll show you vitamin C is. Finally, down to brass tacks, the documents that get generated here can be used for legal purposes and supporting your complaint should you make one to the Health and Disability Commission. Okay, next please. Okay, now from the Code of Patients' Rights, New Zealand, 1996. You are entitled to receive health care of an appropriate standard. You are entitled to receive informed consent, and I'm going to talk about some important things about informed consent that you might not have thought of, or your doctor. And you are entitled to complain to the health commissioner about perceived malpractice. You're also entitled to complain to your lawyer about perceived homicide. Next. Okay. Now, I pose the question, and I don't pose it as a joke. I pose it as the question. Do you have the right, plain and simple, to health care? Is that a right? Well, most parties would say yes. And I'm not going to say no, I'm not building up to that. But you do not have an unbridled right to a treatment of extraordinary expense, like a transplant, like stem cells. Those might save your life, but you don't have a right to them because they cost too much. Okay? There's this gray line. You don't have the right to experimental or unproven treatments. And you don't have the intrinsic right, especially if your doctor doesn't want to encourage a treatment with a substantial risk of severe side effects. So you don't have the right to any of those things. You have the right to health care, but you don't have the right to a treatment that falls under any of those categories. Next. Conversely, flip it around. You do have the right to any therapy And this would have to be all three of these. That's not prohibitively expensive. Okay, it's not placing a financial burden on anybody. That's established to be effective. You know, like 75 years of literature. And that's not prohibitively toxic or suspected to be. You know, may be associated with the death of 3 or 4 out of millions of people. Next, please. So, vitamin C, for those that you didn't pick it up on the previous slide, is remarkably inexpensive, has been established to be effective for 70 plus years now, and if you want to look, doctors across the world have been given multigram infusions for decades now, and it's not producing a flood of patients on dialysis. Vitamin C, let's flip it around again, quite possibly is the least toxic substance or drug to ever be given to anybody with normal kidneys. It's a mouthful, but it's true. Next, please. Now, boy, was this a pleasant surprise? It actually wasn't the case when Mr. Alan Smith's situation started, but hey, it is the case now. As of January 2010, the Minister of Health, the big kahuna, gave approval, not to vitamin C, but to vitamin C for infusion. Okay? Gave approval to Ascor L500, which is 25 grams of vitamin C and 50 cc's as a registered medicine. Okay? As outlined in Section 20 of the Medicines Act of 1981. Now, all of the health officials in the government and all the doctors will tell you, if you don't give them this information before you ask them this question, that all such approvals are given only to medicines found to be safe and effective. So I pose another question to you. If a physician is not familiar with an approved registered medicine, whose fault is that? Next, please. Okay. Coming to New Zealand has been an educational experience for me. I've learned a new way to treat patients. It's the passing bus therapy. On 60 Minutes 2 days ago, according to the eminent David Gallagher, this is a mouthful, I'll have to say it all, Principal Advisor to the Health Ministry and Senior Intensive Care Specialist. He asserted, made me think, Alan Smith's recovery could have been just as likely from a bus driving by as the high dose of intravenous vitamin C he received. So I pose the question, perhaps Auckland should build a new hospital directly across from the bus terminal. And in a prone position. Next, please. Now, got to approach this legally, unless they decide not to force us to that. Any physician or panel of hospital-based physicians claiming, I don't know how they can claim it in light of everything we just said, but let's say they claim it, that vitamin C is experimental, unapproved, or posing unwarranted risks to the health of the patient, is really only demonstrating a complete and total ignorance and or denial of the scientific literature and a serious question as to what the real motivations might be and the withholding of such therapy that arises. You know, I can't look into the soul of these docs. I'm not sure I want to. It might be a scary experience. So I can't tell you what somebody's motivation is. I can only use what's called the deductive process. You look at the facts and you reach a logical conclusion. My conclusion doesn't speak well for the docs. Next, please. Now, let's sort of talk about what the doctor has the right to. The doctor has the right to refuse to see you or treat you. Hey, don't have any hurt feelings, there's a lot more of them. Now, a doctor does not have the right to deny you any therapy that is inexpensive, known to be effective, and non-toxic. Now, here's where informed consent can come into play. Many doctors have made the lame assertion, well, I don't want to be forced into giving a therapy that has toxicity that I don't want to deal with. I don't want to cause you kidney stones. I don't want to give you acute renal failure. I don't want to put you on dialysis. Guess what? Informed consent. He can discharge his responsibility for such toxicity by drafting another informed consent saying, I understand there was a remote theoretical possibility that vitamin C could hurt or damage my kidneys, but I wish to have it anyway. Then the doctor can't really take the lame kidney toxicity path. And remember that a doctor does not have the right to deny you consultation with any other doctor that may have conflicting medical points of view. Next, please. Okay. Remember. And remember that you all are extremely intelligent people, and it just pisses the hell out of me that doctors and lawyers, gosh, on both of them, don't want to even let you think you have the capability of analyzing something for yourself and reaching a sound logical conclusion. Well, I know you do, and you should never give up that right or be intimidated into thinking that you don't have the capacity. Now, just as ignorance of the law is no sound defense of legal charges brought against you, ignorance of medical fact is no sound defense for the doctor who withholds valid treatment, especially when that information can be easily accessed. Next, please. Okay. Now I'll get a little bit more to the nuts and bolts. Now, while a given hospital may or may not have the legal right to dictate to its physicians what they may or may not do. I mean, hospitals can develop panels, and one group of doctors can tell another group of doctors, or a doctor, what he or she can or can't do. Well, guess what? They're assuming the same or more responsibility for any negative outcome that occurs with that doctor's patient. And don't forget it. The patient and the family of the patient also have the legal right to sue that hospital for any negative outcome that is perceived to directly result from interference in such patient care. Next. Now, in our living proof episode with our guest star, Mr. Alan Smith, it's important to realize that you're already so much farther along than the United States or any other quote-unquote developed country in the world. And you should know that. As horrible as some of the difficulties and conflicts Mr. Smith and his family had, you wouldn't have gotten to first base in the United States. And he'd have been dead a long time ago. What I mean is, newsflash. This hospital in Auckland, whether you want to have negative feelings about it or not, did allow the use of intravenous vitamin C ultimately. And initially allowed it before the lawyer was ever involved. I haven't run across a single hospital in the United States that would allow intravenous vitamin C to be given under any circumstances. So a major roadblock and hurdle has already been overcome here. And you shouldn't minimize that point. So, unless the hospital decides to reverse the way it had already done things, any informed physician, and this would be the catcher, with hospital privileges. So that's the other way they could restrict this is, well, we won't let any doctor have privileges here that has crazy ideas about vitamin C. But you don't necessarily get interviewed about that when you apply for hospital privileges. So unless your pre-existing clinical history is already known, and you're an informed physician with hospital privileges, it would appear to me, unless this New Zealand hospital again backtracks and changes its policy, such a doctor can prescribe and give IV vitamin C in the hospital. And if so, you're well on the way. Now again, you can't underestimate the idea that with all this attention and everything like this, when they feel they're cornered, the hospital could set itself back into the Stone Age of United States hospitals and deny it under any circumstances, in which case you have to go to the next step. Next, please. So, all of this means that the patient and the family of the patient also have the right to sue any physician that refuses to administer a therapy such as vitamin C, especially when no other options other than permitting the patient to die are offered. It should be obvious, but it's not. Based on everything we're talking about, and based on the fact that intravenous ampules of vitamin C are now a registered medicine in New Zealand, you should be able to start demanding vitamin C long before you're comatose and on death's doorstep. Next, please. Okay. Now, very practical point. Very, very practical point. Please do not forget it. I know physicians pretty doggone well. Mostly their warts in their limited golf games. Now, as a practical point, it would usually be most effective to sue the physician alone. Don't get all crazy and pull, whether they have liability or not, and pull the hospital into the suit as well. Why? Because the hospital has deep pockets. If you know you've been screwed out of the health of your relative, make the doctor pay whether you win the suit or not. And if you deprive the physician of time and money and subject him or her directly to stressful proceedings, he or she will have little or no concerns over doing the right thing if the hospital is backing up. But if the doctor is on his own, you're dealing with a much more susceptible prey. And that's what this is. This is a hunting game. This is prey. It's a damn shame that the administration of optimal health care has to even have a discussion or a presentation like this, but we know it needs it. Next, please. Now, doctors have a very strong herd mentality. I mean, they don't want to walk anywhere alone. And the last thing they want to do is be perceived as being stupid or uninformed by their fellow physicians. And that's the sad, complete, and total fact of it. So, You should also remember, especially again, I can't emphasize enough how delightful it is that vitamin C now is a registered medicine in New Zealand, because if, for the sake of argument, anything remotely like Mr. Alan Smith's situation comes up again, and vitamin C is refused, guess what? You not only can sue the doctor because he's not giving a registered, safe, and effective medicine in New Zealand, but his malpractice insurance policy, or a carrier, would quite justifiably question seriously why this approved medicine was withheld from the patient. They don't want to back up doctors doing illegitimate things. And so guess what? Then you have a doctor paying out of his own pocket for his defense. Believe me, this would only have to happen a handful of times, maybe one time, before every doctor in the community has diarrhea. Next, please. Now I'm going to talk a little bit about legal theory when it comes to this, okay? It's just something to give the talk a little bit of perspective. It's not necessarily something that you need to keep in your head if any actions like this come up, because it would ultimately be something that would be dealt with by your lawyer. Now, in a court of law, legal decisions regarding medical issues are usually decided by comparing a doctor's actions or inactions, comparing them to the accepted standards of medical practice in the community in question. The legal sticking point is and relates to how different that community might be from others, and whether a different accepted standard of practice is too far away from the standard normal practice. Next. Now, in the case of vitamin C, abundant peer-reviewed scientific literature exists. We've discussed that. But this is another thing that keeps it all going. It's the myth, or the mythology, I should say, of the medical textbook. Okay? Now, if you had never looked at a medical textbook, I'll give you the short version. They have, maybe 150 tiny chapters in it on a different section of medicine. And each chapter is authored by one or two doctors. That's it. And there's only really two medical textbooks. I think this is probably the case in New Zealand too. I think it's the United States, and that's the Cecil Textbook of Medicine and the Harrison Textbook of Medicine. There really aren't any other pretenders to those two. So, depending on what the subject is, all of the information on that one topic depends on the perspective of one or two doctors. Yet, the final product, that final medical textbook, gets worshipped like the golden cow. Now, what happens is, when the textbook is first written, the doctors undergo a review of the literature, and they write what they think is appropriate. Now, let me tell you something. If you don't make it into the textbook in what I'm saying, maybe 1930, 1935, 1940, something like that, if you don't make it into the textbook in that first edition, and you existed before, you never make it in. Information originally excluded is always excluded, because when the new editions come along every 3 or 4 or 5 years, the same doctors or their successors come along and just look at the literature that's accumulated since the last edition of the textbook and modify the section a little bit. So once excluded, always excluded. My book has over 1,200 references on infections, toxins, cures for different diseases, incredible laboratory test results of what vitamin C does with different toxins and different infections, and you look in the bibliography of these two 2,500-page textbooks with like tissue paper, vitamin C is not mentioned. So, I won't get into conspiracy theories, but I will tell you this is one reason the doctors have such a great deal of difficulty. They just simply say, well, if it's not in the textbook, it can't be of any value. So until somebody like that actually gets off their butt and dusts it off, looks in their computer, goes to the library, and reads a few things on their own, that attitude won't change. But it's an important thing to keep in mind because that's how doctors think. Next. Now, the legal system struggles with reconciling something well established in the medical literature but not reflected in the standard medical textbooks. Okay, so the legal system tends to go along with the mainstream. You know, they'll get the professor of medicine at the local medical school to be their expert. You're dealing with already a built-in bias in most courts of law, to my way of thinking, before the evidence ever gets displayed. Now, I do think the times they are a-coming and the times have changed. Nothing could be more difficult to predict than what is the outcome in a court of law in any given case, but I will tell you, a case involving withheld vitamin C would not currently have any direct legal precedent of which I'm aware, so it would be virgin territory, if you will. But I think there's multiple reasons that the time is right for the law to rule for the patient's right to receive vitamin C in the hospital over the doctor's quote-unquote right to withhold it. Next. Okay. And this is a point that should be made. We've talked about this. There's lots of doctors giving lots of IV vitamin C. But it's also important, especially in the development of legal theory, because they always like to throw around credentials in the court of law. We're talking about a growing population of traditionally trained physicians with the same medical credentials as their mainstream counterparts, coming up with different conclusions. And like anything, there has to be a point where a critical mass is reached and the law has to decide, well, things aren't black and white, but if we have a group of doctors with the same training, same medical background, that can look at the literature and come to a different conclusion, there has to be an allowance for those type of therapies. Next. Okay. So, this is the school of thought. And the question comes, what is the critical mass? When are enough doctors reached? Next. Now, in the United States, I don't know that this applies in New Zealand, but I think the basic principles probably do. They had two big Supreme Court cases in the United States, and the first one was the Fry case, 1923, which held that expert opinion was based on a scientific technique is admissible only where the technique is generally accepted as reliable in the relative scientific community. Well, to put it in simple words, that means majority wins, minority loses. Because the general accepted thought in the community of medicine or science or anything else is going to be the thought held by the majority. And that stood in the United States for a very, very long time until next. Until the Supreme Court case, Gallert, 1993, came along and allowed the court to modify their approach to science-based expert testimony cases. And the Daubert court held that it should first evaluate whether what is being talked about, like we talk about vitamin C, they say, has it been tested? Number two, has that science been published or peer-reviewed? So we have yes, Consider the likelihood of error, quality and quantity of data. Huge quality and quantity. Yes. Finally, evaluate the general acceptance of the theory in the scientific community. And that's where the wiggle room comes in. How much respect do we give to a growing number of doctors that don't agree with the larger group of docs? Next. So, if the court is so inclined, the evaluation of general acceptance in the medical community does not have to invoke the majority rules of the Frye Standard, but it can allow the consideration that enough scientific studies embraced by enough qualified doctors could prevail legally. However, and this is important just as a point of fact about law in general, any ruling in any case is going to be heavily dependent on the facts and what they're trying to determine in that case. Actually, a lot has happened just since I first put this together about a week ago. And I gotta say, I don't think it's going to have to come anywhere near that. It's not going to have to get to that point. The way things are structured now in New Zealand, with you having a registered medicine, vitamin C, with the data that we're talking about, and with, and this is important, please remember, with the indignation of the population in a small country where the politicians can't escape your wishes if you don't let them.
Yes.
Okay? You have so much power. And I don't say this lightly, you have the power to change the world. Because, scenario, a struggle comes forth, and they say, we'll use vitamin C. Okay, it's a registered medicine. Might not seem like anything big, but let me tell you what's going to happen. Mark my words. Go back to this lecture. Listen to it again. When vitamin C starts being used anywhere near routinely in the hospitalized setting in New Zealand, and I think there's every excellent chance now that it will, what will happen a year down the road? Maybe not that long, or maybe a couple years down the road. Well, your big brother next door, Australia, is going to say, we're sick and tired of seeing the Kiwis get better while we die. And guess what they're going to do? And then guess what? No matter what your critics say, you're not a third world country. You're a modern, developed country. And once New Zealand and Australia has it, the whole world will follow. For the same reasons that Australia followed New Zealand. Mark my words. We are at the dawn of a new age of medicine, not to be too melodramatic. Next. So the principles of law don't assure a victory, but like I said, I don't think we're going to have to even go there. Next, please. So, this is another important legal point when you're struggling back and forth with your doctor, is the strong legal point, and this is very big in any case of it's your fault, it's my fault. A strong legal case can be made that the burden of proof falls with the doctor to show, why is my vitamin C exceptionally expensive? It isn't. Why is it toxic? It isn't. Why is it unproven? It isn't. And the burden of proof to show that the patient's best interests were somehow best served by withholding the vitamin C. Next. Another legal document for New Zealand, your Ministerial Advisory Committee on Complementary and Alternative Health. I hate those words, as I mentioned. But for the time being, that's how something like this will unfortunately be alluded to. A recommendation of the government that where there is evidence of safety, yes. Efficacy, yes. Cost effectiveness, yes. your public health system should attempt to utilize such a mainstream therapy. No. It's there. It's a registered medicine, and your own legal documents are indicating that's where your public health system should go. Next, please. Now, always try to make an alliance with your doctor. I mean, why not? What do they say? More flies with honey than vinegar. Something like that, okay? Nothing wrong. And I got to say this. I mean, I'm trying to tell it like it is as best I can. But I think most doctors want to see you do well, but they want to see you do well on their terms, which is sort of a convoluted way to think, but that's how they think. And they don't really want to see you die, but they don't want to see themselves exposed as unintelligent or uninformed. So it's a constant push-pull. But try to avoid the adversarial relationship, obviously. But ultimately, don't hesitate to tell your doctor if you're not getting where you want to go, that you will avail yourself of all your rights. Next. So, I mentioned this earlier. Just like our buddy on television that suggested the passing bus therapy. A very common out of all these scenarios is suggest that further studies should be done. No. 75 years is enough. Don't let them have their delaying tactic. If they want to do more studies just to refine something while you have the right to use vitamin C, well, great. That's fine with me. But no more further studies to delay the widespread usage. Remember this. You and you alone. It's still horrible. I got to say it again. I agree. It's an absolute travesty that you just can't blindly trust your doctor. You should be able to blindly trust your doctor, but guess what? You can't. You have to stand up for your rights because the way medicine is practiced, always look at history, will never change until the public demands it and the law legitimizes it. It's your body and your health, and doctors are answerable to you, not you to them. Next. Okay, and these again, I mentioned, if you want to write this down, my website, tomlevymd.com, the peakenergy.com will also forward to the same website, tomlevymd.com or peakenergy.com. Next week, and this whole presentation will be up there, and you can just on your computer directly click to get to these different references, print out the articles, have all the information you need. Next. So, one more final thought by the wise philosopher Henny Young. This guy's doctor told him he had 6 months to live. The guy said he couldn't pay his bill. The doctor gave him another 6 months to live. Thank you. Stand up for your rights. Stand up for your rights.